Since inception, the RAC has contributed to bridging the gap between researchers and programmers or policymakers so that evidence-formed decision-making has been possible for improvement of health service practices and drawing policies that are targeted at the introduction of cost-effective public health programs. Among a few, the most notable contributions of the RAC are an economic evaluation for the introduction of birth dose of hepatitis B virus vaccine to the immunization program, review of existing literature to examine the effectiveness, feasibility, and applicability of tranexamic acid, uterine balloon tamponade, non-pneumatic anti-shock garment, feasibility of community-based distribution of misoprostol for treatment of postpartum hemorrhage, synthesis of evidence about the use of chlorhexidine for prevention of umbilical cord infection, synthesis of evidence and opportunities to promote early childhood development in Ethiopia, identification of promising practices for increasing family planning used through community approach in pastoralist regions, and synthesis of evidence on factors associated with utilization of long-acting reversible and permanent contraceptive methods in Ethiopia. In this video, 2 products of RAC will be featured to demonstrate RAC's knowledge translation role in practice. These are economic evaluation of introduction of birth dose of hepatitis B virus vaccine to the immunization program, review of existing literature to examine the effectiveness, feasibility, and applicability of tranexamic acid, uterine balloon tamponade, and non-pneumatic anti-shock garment for the management of postpartum hemorrhage.
የመጀመሪያው እንደምታወቀው የሄፓታይቲስ በርዝ ዶዝ ማስገባት ያስፈልግበት ምክንያት እንደ ሀገር ከዛ በፊት የኤስቲዲጂ ላይ የሄፓታይቲስ ኤሊሚኔሽን ወይም ለማስወገድ በ2030 ከፍተኛ ጥረት አለ ዓለም አቀፍ ደረጃ ማለት ነው። እሱን መሰረት በማድረግ የሀገሪቱ የብሔራዊ የክትባት ክፍል መሰረታዊ ጥያቄዎች ነበሩት። በሀገሪቱ ብናስገባው አዋጭ ይሆናል ወይ የሚል ማለት ነው። ይሄንን አዋጭነት ደግሞ በኤቪደንስ ቤዝድ መሆን አለበት። ስለዚህ ኤቪደንስ ጀነሬት ሊያደርግልን የሚችል ማን ነው ተብሎ ነው ጥያቄው የተነሳ ማለት ነው። ያንን ጥያቄ ይዘን በደንብ ጥያቄውን አስተካክለን ነው ወደ ሪሰርች አድቫይዘር ግሩፕ የወሰድነው። ይሄንን ወደ ሪሰርች አድቫይዘር ግሩፕ ከወሰድነው በኋላ ሪሰርች አድቫይዘር ግሩፕ የራሱ የሆነ የአሰራር የሲስተማቲክ ሪቪው እና ሌሎች አስፈላጊ የሚባሉ የዳታ ሲንተሲስ ስራዎች ሰርቶ የኢንክሪመንታል ኮስት ኢፌክቲቭነስ አናሊሲስ ኤቪደንስ ጀነሬት አደረገ ማለት ነው። ስለዚህ አዋጭ ነው፣ በጣም አዋጭ ነው።
The most important finding that came out of this study was introducing birth dose of hepatitis B in the Ethiopian setting is cost effective. The hepatitis birth dose prevents infection in infants and children. And this prevention actually, incurs costs to the government because of vaccination rollout, but it prevents, other expenses which could occur later in life because of, hepatitis B disease. This includes chronic liver disease and hepatocellular carcinoma. What we found was, to save 1 year of life, it would cost around 110 USD.
One of the call to action pointers or agenda is introduce new evidence generation and data to action. There is 3 important thematic areas that is identified by Research Advisory Committee and Maternal Health Team. One, UBT, uterine balloon tamponade. Uterine balloon tamponade in Ethiopia is not implemented, but other countries and WHO recommended, but not implemented in Ethiopia. The most important intervention to decrease maternal death by postpartum hemorrhage, especially hemorrhage, NASC, WHO recommended, but other countries can be utilized properly, but still in Ethiopia is not properly implemented. The other is tranexamic acid. Tranexamic acid in Ethiopia totally not utilized but other country and WHO recommended for tranexamic acid.
Informed by the evidence supplied by the RAC, the Ministry of Health has made a decision including uterine balloon tamponade and non-pneumatic anti-shock garment in the management package for postpartum hemorrhage. Currently, 5,654 units of non-pneumatic anti-shock garments have been distributed to all government health facilities in the country, with appropriate training provided to health workers. The use of uterine balloon tamponade and tranexamic acid is being piloted at a smaller scale in different parts of the country. The RAC has proved to be instrumental in bridging the divide between those who produce evidence and those who are expected to use it. Transferring research evidence into healthcare policy and practice results in reduced health inequities and waste resource. One good example is RAC's provision of evidence that introducing a birth dose of hepatitis B virus vaccine in Ethiopia would likely be highly cost-effective with investment of $110 per daily averted. The Ministry of Health would like to commend RAC for providing this invaluable evidence and FINOT for facilitating RAC's activities. It also calls upon development partners to work with the Ministry of Health in scaling up such a cost-effective and life-saving intervention.